Good morning, Dr. Ryan.
Good morning, Mark. Merry Christmas to you.
Yeah, Merry Christmas to you, and good riddance to 2020, and Happy New Year to all of us.
Yeah, I couldn't agree more.
Well, what do you think? Let's start out by giving folks a status update of the virus here in Clear Creek County. Where are we at?
So in Clear Creek County, we're continuing to head in the right direction, making little progress as we go. We're currently at about 330 cases per 100,000 as of yesterday. We had 32 cases in the last 2 weeks. Our test positivity continues to be below 5%, which is great. We're going to be testing again this Wednesday in Idaho Springs at the Curative site, for which you need to pre-register before you go. So our numbers are headed in the right direction, and we need to continue to stay the course, as we've said since the beginning. Now is not the time to relax. What we have done will disappear. So it's time to continue to wear your mask and social distance and do all the things that we've been asking to do. And as you alluded to, we now have a vaccine in the arsenal, which we're rolling out actively as we speak. And so hopefully that will have a meaningful impact here in the next several months. But it's going to take a few months for that to get to that point. So, and even once you've had a vaccine, you still need to wear your mask and still need to social distance and all those sorts of things. It does not free you from those sorts of responsibilities. It's merely another indication of protection for yourself, not necessarily for those around you.
Dr. Ryan, I wanted to ask you one follow-up question on the caseload here in Clear Creek County. I know that some months ago you were encouraged that we didn't have much in the way of community spread, but I wonder if that's still true, or is the increased caseload through community spread, or is that still folks picking it up someplace other than from their neighbors or family members?
Yeah, a good question, Mark. Right now, we're not seeing community spread. What we're seeing is individuals making choices and going to social gatherings and those sorts of things and getting it from there. Not any from direct contact out in the community, but people going to social events, people getting together with friends, people staying the night at their homes, and that sort of thing, and traveling continues to be a leading cause of it. But not as far as community spread within our community. Seems to be absolutely minimal. So again, back to people's own personal behavior, not going to those social gatherings, not going out of state, not traveling by plane, and those sorts of things will really help minimize your risk and potential transmission of the virus.
Okay. Well, the elephant in the room, I guess, is the vaccine and its deployment. I know that the federal government had made some predictions earlier that there might be as many as 20 million people vaccinated by the end of the year. As of yesterday, I saw that there had been 10 or 11 million vaccines distributed, but only slightly more than 2 million had been administered. I see that we're not going to reach that 20 million number, but what's your assessment of how the distribution, the rollout of the vaccine is going so far, and where we're headed in the next few weeks, let's say?
Yeah, I can really only speak about the rollout here in Clear Creek County and more broadly in the state of Colorado. I know in Colorado it is going smoothly. We have now 2 different vaccines, the Pfizer vaccine and the Moderna vaccine. In Clear Creek County itself, we are only using right now the Moderna vaccine. We got our first batch last week. We were able to disseminate all of that in a single day. As of this morning, we received our second batch of the Moderna vaccine, 200 doses this time. And so we're hoping tomorrow to disseminate all of those. And we'll continue to do so each week we go forward. We don't know yet weeks ahead how many vaccines we're going to get in any week. It seems to be a week-by-week scenario, and I think that's driven a lot by the federal government and some of the disruptions that they've seen way up the food chain. And so what the state of Colorado gets, they don't really know until a week or so in advance. So right now, we're going to continue to get them, hopefully each week, and disseminate that out to the residents in Clear Creek County.
Well, I know you have your ear to the ground, and I was hoping you might have some special insight, but it sounds like you're reacting as the rest of us are to information as it comes along. I will say one piece of happy news on a personal note. My daughter, who is a frontline medical provider, received her vaccine on Monday. That was certainly joyful news for us. I wanted to ask you, Dr. Ryan, about the CDC guidelines and the state of Colorado's guidelines, how they may differ.
In terms of who gets the vaccine?
Yeah. For instance, in the CDC guidelines, the phase 1A, I like the way they call it phase 1A, B, and C rather than phase 1, 2, and 3. But nevertheless, phase 1A is frontline health care workers and long-term care facility residents. That's the federal CDC guidelines. And then that's followed by phase 1B, and that's the folks over 75 and frontline first responders, etc. So is that basically the way the state of Colorado is going forward, or are there some local differences?
No, there are some differences locally, and the CDC guidelines are just that. They're guidelines. They know it's not a one-size-fits-all. Obviously, in Clear Creek County, we don't have a hospital, so we don't have what can be considered 1A. So we started with 1B. And one other sort of nuance to this entire thing is the federal government entered into a contractual agreement with CVS and Walgreens to disseminate vaccines to the hundreds of thousands of seniors who live in nursing care facilities. So the state of Colorado and any one county that has any of those facilities are not the ones that are going to be potentially vaccinating those folks. In fact, CVS and Walgreens are supposed to be vaccinating them. And those vaccines are taken right off the top from the federal government's supply to the state of Colorado and every state in the union. So as far as we're concerned in Clear Creek County, we are following those guidelines as best we can in terms of what we have on the ground. We started with 1B with EMS, law enforcement, fire, and those sorts of folks, and the frontline workers, and our nurses, of course, at public health, because after all, they are the front line. So, and then we're going to be moving forward through the different 1C and then into 2. And as we go, we're going to be queuing those folks up as much in advance as we possibly can, and make sure that we have those arms ready and available when we give out the vaccines. Primarily because once you take that first dose out of the vial, that vial has to be used within 6 hours. The clock starts ticking. So you need to have 10 people lined up for each vial that you are intending to open. And so it's a very important logistical challenge that we're trying our best to make sure that we have people lined up and ready to go to receive vaccines as we receive them.
Can you tell us a little something about that process? For instance, any one person within the community, how would they know that they are in line for the vaccine?
So we've decided to adopt what I would call a champion model. I don't know if that's the technical term for it, but what we're trying to do is, I'll give you an example. Sheriff Alberts is responsible for his entire staff. So he's responsible for asking who is willing and wanting to get the vaccine, and then collecting their information, and then providing them a time slot within our day to get that vaccine. Now, it's incumbent upon him, Sheriff Alberts, to, again, make sure that all of his staff that got the vaccine the first time return in 28 days for their second round. It's critical. Our staff does not have the resources and availability to contact everybody in making sure that they're coming back. So we're having that one person as the champion for that entire group. and we're going to continue this model moving forward as we get more broadly out into the community. So as an example, a place of employment may be a way that individuals get their vaccine, not from their employer, but obviously their manager or supervisor would be the champion for a specific business in the community who would logistically line up these people, rhetorically speaking, and get them ready and queued for us so that when we call business A, B, or C, we say, you guys are up next Wednesday. All of those individuals who are willing and wanting to get the vaccine need to show up at this time, et cetera. And then that way we only have, 10 or 15 people to call the champions, if you will, instead of the 200 people that fall under all those champions.
Well, that sounds like a workable system within the boundaries of businesses and other organizations. But, I guess I wonder about myself as a 70-year-old a person here in the community. How will I be notified that I'm in line for a vaccination?
Great question. So we're reaching out to any and every organization in the county, particularly the county, some of the county resources, Health and Human Services as an example, the Senior Center, any number of different organizations we're reaching out to in the same fashion to say, you are the champion. Who can you identify within the community that uses your services or frequents the Senior Center as an example? Can we come up with a list of folks from the Senior Center who would want to get the vaccine and then sort of line them up that way? Once we get beyond those sorts of organizations and ways to contact, and we get to the sort of what we call free-range individuals that aren't associated with a business and aren't associated with a specific organization, we're going to try to reach out in a number of different ways. Email, phone calls, Facebook posts, etc., radio interviews like this, to have them specifically call in. And we're not quite to that point, and we don't have all of the specific details worked out yet. But the folks who are 65 plus, we are putting obviously at the top of our list moving forward in the next several weeks. It's going to also depend on if next week we get 100 vaccines or if there's a week where we don't get any. We don't, like I said, know too much in advance, so it's very hard to queue up 100 or 200 people for next week when we don't even know whether we're going to get 100 or 200 vaccines. So right now we're queued up, I think, for the next week or two at the minimum, and then we're going to go beyond that.
Well, it's quite a challenge ahead of you. And then trying to follow up with a second a dose of the vaccine with all of these people who need the vaccination twice. That's an incredible mountain to climb. I know that there are other vaccines in the works, and I think it was Johnson & Johnson and maybe AstraZeneca that had theirs was based DNA-based vaccine that required one dose, maybe not quite as efficacious, but those are somewhere in the pipeline, not too far from review. Is that correct? Do you know?
I know the AstraZeneca vaccine is currently under review in England. England seems to be a week ahead of two of the rest of the world in terms of their review of the results from the clinical trials. So I know this week is likely to be approved in England and will be widely used there. So I can't imagine it'll be far behind here in the U.S. Johnson & Johnson, I think, is a little bit further behind, a couple weeks. So I would guess by midwinter or late winter, we should be seeing an additional one or two vaccines to add to the whole mix. So yes, a little less efficacious, but 60-70% is still very good protection, and that's, to be quite honest, what they were expecting for most of the vaccines. And so the two that we have now, the 90+% efficacy is really unheard of in the world of vaccines and around COVID-2. And so hopefully we can get additional vaccines in our arsenal so that we have the ability to vaccinate as many people as possible in any given week.
I'd like to speak about this efficacy rate because I think there's a confusion in people's minds, maybe a little bit in the general public, certainly in my mind, between the difference between efficacy and effective vaccination. Those are two very distinct things. When you take a subset of the population and you inoculate them, and then you see if they come down with COVID, that gives you your efficacy rate. But an effective vaccination regime requires that a certain number of people become vaccinated, and I guess I have some concern around that there seems to be some reluctance and even some voodoo predictions out there on certain cable networks by certain rich prognosticators on those networks about how dangerous it's going to be, and don't do it, and let some other guy do it. I just wish, I'm kind of rambling now, but I wish you could speak a little bit to the need for so many people to become vaccinated, for it to become effective within our community and worldwide.
Yeah, Mark, I think in general I would say vaccines have fundamentally changed human health throughout history and continue to do so. You think about the devastating effects of polio and measles and mumps and rubella, and the list goes on and on and on and on. And vaccines have fundamentally changed our interaction in the world today, right? They've allowed us to live freely and to not live in fear of viruses and other things that can potentially kill us. So as far as this vaccine is concerned, the one that we're using in Clear Creek County, the Moderna, is a 94% roughly efficacy rate, meaning that as an individual who receives that vaccine, you have a 94% chance, reduced risk of actually getting the virus in a serious way. So the Moderna vaccine, for example, it doesn't prevent you from getting COVID-2 100%. What it does is it prevents you from having any significant or severe indications from it, meaning you're not going to be hospitalized, you're not going to die, you may not even know that you have it. It does not mean, though, yet, and we don't understand fully, and they're collecting data on this as we speak, of whether you can get it and subsequently give it to somebody. So even though you yourself are protected, you may be able to get SARS-CoV-2, COVID-19, and then subsequently give it to somebody else, even though you are vaccinated. This is why it's critical that as many people as possible get vaccinated, so that the impact that the vaccine has on it, on the population in general, is as much as we possibly can. It's what people have referred to as herd immunity. There's only two ways to get the herd immunity. People with enough exposure to it historically, meaning you have been exposed to this year after year after year, and you have memory cells in your body that say, hey, I know what that is, I'm going to fight it. The other way is for you to have a vaccine in your system, which does the same thing, right? Your memory cells say, hey, I know what that is, I'm going to fight it. Now, in order for you to slow significantly in transmission throughout society, enough people have to either have memory cells that have previously had exposure to COVID-2, or you have a vaccine. And since this is a new virus this year, not enough people have that memory cells from prior exposure. So it's fundamentally important that as many people as possible, north of 70%, get the vaccine, because only 16% or 17% of the Colorado population is currently thought or estimated to have had SARS-CoV-2 or COVID-19. So the vaccine is fundamentally critical at this point, that everyone get it that possibly can. There are people in our society that cannot get the vaccine for a whole host of reasons, underlying health conditions that prevent them, individuals who are on chemotherapy or folks like that. They can't get the vaccine. So it's incumbent upon the rest of us to help protect them, because they don't have a choice. It's not a comfort of a choice. I just don't want to get it. they can't get it. So we need to do everything we can as society to help protect those folks. This vaccine is safe and efficacious, as you've already stated. Why am I comfortable and confident in the safety level? Because 3 independent review committees looked at it, in addition to 3 additional boards. The boards on each one of the companies, Pfizer and Moderna as an example, they also have an independent advisory committee who looks at the data. And then when it gets to the FDA, as you saw publicly several weeks ago, there's an independent advisory committee made up of doctors and professors and virologists and epidemiologists, et cetera, who look, again, independently at that data, as does the FDA, who have professionals there who've dedicated their career to this sort of thing, including the folks like Dr. Fauci. And then it goes to the CDC, who also has an independent advisory committee board looking at the data and understanding what happened and what's going on, and then also the folks at the CDC. So that's multiple layers, and this is true for any vaccine that comes out. No steps were skipped from a safety and efficacy perspective on this vaccine. The time warp thing is everything else that happens in vaccine development world is where the time shortcuts were taken, not in the safety and or efficacy. So I received the vaccine last week myself, and I felt a soreness in my arm, as I have in every other vaccine I've had in my lifetime. I had no other side effects. And of the 100 that we vaccinated last week, I think only one individual had a slight fever for about a half a day, and it resided. And the very next day I saw him, and he was totally fine. So are there indications for some individuals? Yeah. Some people, no matter what vaccine they get, they're going to have anaphylactic shock. They're going to have a reaction to it because they're allergic to something in there. We're ready and prepared for those folks. We have EMS who's standing by and ready to go if that is in fact the case, and we can handle that. And as you heard, I've only heard of 5 instances across the entire world so far of individuals having anaphylactic shock from either the Pfizer or the Moderna vaccine. So if you take into consideration, what you say, 2 million plus people have received the vaccine so far in America, and I've only heard of 3 folks who've had any sort of reaction to it beyond minimal effects. So in my mind, it's worth it to help not only protect you yourself, but also to further protect society. And if we want our economic engine to start up and to rev up again, this is a critical component in that. People say, I'm tired of this, I'm tired of wearing a mask. Me too. But here's the thing. You can't have your cake and eat it too. If you want society to go back to the way it was, restaurants open and businesses open, you either need a vaccine and you need to continue to wear your mask, because without those 2 things, we're not going to go back to normal. We're going to continue on this perpetual up climb of cases and fatalities in our country. So it's either time to step up and get your vaccine and continue to wear your mask, or recluse to your home and don't come out, are really the 2 options, in my opinion.
Well, I'm glad to hear you say that you have received the vaccine. I think that your leadership should help guide us within our decision-making process. And I will second what you said about sore arm. Every time I've ever been vaccinated for anything in my life, I've had a sore arm the next day, or sometimes for 2 days. Big deal. I got a stat for you. I this morning, knowing that we were going to speak today, I went on the New York Times website. They track the daily death count and the case count and the hospital count. But I went back in time to December 10th when the Pfizer vaccine was approved for administration in the general population, and I counted the number of deaths since then, and unfortunately 45,317 deaths have been recorded from COVID-19, 0 from taking the vaccine. Let me repeat that. Nobody has died from the vaccine. 45,000 plus have died from COVID since the beginning routine of administration of the vaccine. That tells me everything I need to know, because you can do tests for vaccines and you'll have some tens of thousands of people who have been tested. When you start talking about 2 million in the United States and tens of millions around the world, nobody has ever died from the COVID vaccine. Then I think that begins to tell you just how safe it is and just what a miracle it is for all of us. And we should all be just eager to stand in line to receive that vaccine if we are physically able to do so.
Oh, absolutely. I couldn't agree more. I mean, if any other thing in our history killed 45,000 plus Americans in less than a month, everyone would be absolutely outraged. And here we are, 335,000 plus dead in less than a year's time, and we still have half the country who thinks it's a joke and thinks that it's not real. I don't know what's going to wake those people up. I'm hoping that something personal, maybe, so that they realize that this isn't a joke. It's very serious. It's killed way too many Americans in less than a year's time, and we do have an answer to it. It's called a vaccine, and now's the time to step up and get that vaccine.
Well, I would like to take a moment while we're speaking to encourage all of the employers, the larger employers in Clear Creek County, to do as my hospital system, when I was in the medical profession before I retired, they required me to have a vaccination for the flu every year, flu shot or don't come to work. And I don't at all consider that to be unreasonable. If you are going to be interacting with other people in your job, then it is your responsibility as an employer and as as personnel in those facilities to become vaccinated. That's my personal opinion, and I don't think that that's a harsh overreaction in any way, shape, or form. You want to protect your business and get people back in the door, be able to hang a sign that says all employees have been vaccinated.
Oh, absolutely. Absolutely. I think that as many people as we can get vaccinated, the better. The sooner we can open back up, and sooner we can have parties and hug each other and spend time with each other and do things that we have done in the past and continue to thrive as a society. I think it's absolutely critical.
You know, Dr. Ryan, now that the vaccine is out there and you're telling me that as a 70-year-old, it's within sight, my chance to receive the vaccine, I have redoubled my efforts to remain safe, because I am resolved. I am not going to be the last guy to come down with COVID. It's just not going to happen. I've been through too much. We've all been through too much. Why would we take any chances now? Now is the time to redouble your efforts.
Yeah, Mark, and I can't make any promises, but if we continue to get the vaccines at the rate we're currently getting them, you and folks like yourself should be vaccinated within a month's time.
Wow, that sounds great. I'm going to start looking for flights to Italy.
From what I understand, a lot of European countries are going to require that in order for you to come, you need to be vaccinated. They do not want to take the risk, and even moving forward. So you're going to need a vaccination passport of sorts, and you can probably now say it will include a COVID-19 vaccine.
Well, I require it of myself, and I'm glad to hear that they're doing that as well. I won't even go into a local restaurant until I'm vaccinated. I'm sorry, I just am not going to do it. I love my local community. I do everything I can to support my local community. I have for a long time, and will continue to do so. But I'm not going to take any personal risk. And as hard as they've tried to make it as safe as possible, I'm just not doing it until I have a vaccine, and I won't be traveling regardless of what the regulations may or may not be. I'm just protecting myself and my family, and that's that.
Yeah, I agree. And perhaps, Mark, this year we'll have time to to sit down and have a cup of coffee face to face and have a chat over a cup of coffee in a local coffee shop.
I'm buying. So, Dr. Ryan, thank you for your time today. I'll give you an opportunity if you want to make any closing statements.
Yeah, Mark, like I said, for weeks and months now, please do not stop wearing your mask. Now is not the time. Continue to wear your mask. Continue to social distance. Please do not have parties and get-togethers, particularly around New Year's Eve. I know it's tempting. But we did really well at Thanksgiving because most people heeded the advice and didn't do what they weren't supposed to do and have gatherings. So I would ask that you continue to do that over New Year's Eve. Do not go to social gatherings. It isn't worth it. We're almost there. The vaccine is on the ground. When it is your turn, please come and get the vaccine. Our nurses are some of the best in the business. The little pinprick. And then a sore arm for a day, but then you are on your way. But even then, once you've been vaccinated, we're going to need to continue to wear a mask and socially distance for a little while longer. I know we've been saying that for a while, but now we have vaccines, and now we have a way to broaden our community's immunity and make it so that more and more people are protected. And we need to get to that magic 70-80% so that we can open up and thrive again, as we know. From days past. So, Happy New Year to everybody, but please be safe.
All right, Dr. Ryan, thank you so much for your time today. Happy New Year to you. I hope you and your family are safe throughout, and we'll talk to you again soon. Maybe in a couple of weeks, we'll have even more good news to share. Until that time, please take care and keep up all your good work.
All right, thanks. Appreciate it. You too.
Bye.
Bye.
All right, everyone. That was Dr. Ryan, our Department of Health director, with good news about the vaccine. Boy, I can't wait. But I'm not kidding. I'm not going to be the last guy. And I hope none of you will be that person either. Double down, redouble your efforts. Now's the time not to get it. The COVID, because vaccination is within sight. We just passed December 21st, which is the winter solstice, the darkest day of the year, and I kind of look at the end of COVID like I look at the gradual return of the sun. It's going to take a little while, but we're going to get there.